All this is Dr. Mobeen Sayyed from drbeen.com. Welcome to one more show. So today is Friday, tomorrow and day after is the weekend. I hope you all enjoy your weekend too. Rubies, I'm so happy that you are here. Welcome. Carolyn, hello. Christy, hello. James, hello. T, hello. Shri, hello. And what do you think so far? To me, it seems like it may be necessary for us to look at our channel and make small playlists, but it seems like prophylaxis is available, acute disease management is available, various drugs and their mechanisms are available, vaccine related clotting, what to do is available. Cardiac, I still do not have enough data there, so not much for the cardiac issues. Long haul post COVID, long haul post vaccine. So there's a lot that is become available. We together have done this, lots of work. Jim, hello, how are you doing? Hope you're doing well. Carly is here. Texas is here. S-Sun, I saw you after some time. So Arun, you had a question. I saw that on the last one. So the evidence on the vitamin D, I did some more research after I spoke with FLCC's panel. There are both kind of studies available that say vitamin D would cause activation of M1 or conversion of M2 to M1, and vitamin D converts from M1 to M2. So it seems like just take normal vitamin D 4,000-5,000 or whatever you are taking. It may be interesting in long haul to quit vitamin D for some time and see, does that help? If that help, then don't stop vitamin D altogether, but bring it down to a little lower value amount, dose. Drbeen, how are you? Roman, how are you? Hope you're doing well. If you were here, we'll go to San Francisco together and have a cup of tea or coffee together. Michelle, would be great to have flip guidelines like ACLS protocol. Yes. Who would help me put them together? 7 out of 72. Get pawing. Yes. If France was here, she would say, paw the button. And then Doug would say, yes, do it. Where is Doug? Cindy, hello. Barbecue Bean, hello. Stephanie, Bean family, hello. Back to you as well. Peter, hello. Manuel Sosa, hello. Okay, so Adina, hello. Cat Bean and Lotus Bean checking in. Trillium is here. Okay, ask away. Here is a question, Smoke Curl. Will there be a monocyte upregulation or downregulation in such post-vaccine long haul? Any chance? So, of course, if there is a post-vaccine long haul, that means there is these non-classical monocytes that are, I don't know if we should call it upregulated, but that are persistent, that have become long-living. One. Second, of course, then they are active and they are causing cytokines, which would mean the remaining inflammatory system will go up as well. That means whatever is the propensity of a person, for example, they have autoimmune diseases, their autoimmune disease intensity would go up. For example, let's say they have rheumatoid arthritis, that would go up. So wherever inflammation was bothering them, let's say they had GIT symptoms, they will go up. Let's say they had some other symptoms in the brain areas, they would go up. So I think the important thing is that as these cells are triggered and they continue to produce cytokine, they would keep everything up. So I would say this way, Smoke Curl, that they would possibly upregulate the whole immune system, or amplify, as we call it, for immune system. They'll amplify the whole immune system. Michelle, yes, how are you, Michelle? Here, how do you make a comparison between underdeveloped countries that have better survival rate because they're physicians and clinicians versus developed countries that are pharmaceutical reps instead? We can actually see, Michelle. So I was on a radio interview this morning and the host asked me this. They said, how do you see our responses and where are we going with this? What is our learning? And I said that and I say it here many times, our response here in the US, I don't want to talk about other countries. US is where I am, and so I can talk about my country here. US's response showed that we were okay with run of the mill day to day routine tasks, and all of our red tape and bureaucracy and the approvals and disapprovals and procedures and processes were aligned with that. And as soon as exception would occur, our system goes nuts and does not know what to do. And one example is the people who need insulin. Insulin is a 16 bucks or lower priced item, and people die because they don't have money. We sell it so expensive. So our system is not calibrated to handle exceptions. And I said to him, I said, look, with the COVID, the whole world got stuck, including US, and we all became an exception. And our system had no idea to handle exceptions. And then we failed. So, and my thought was, and I shared it, I don't think that this will be very valuable for us to say WHO should go away, or CDC or FDA. They're not going to go away. They are organizations that are part of the processes. They are well funded. They are well established. They're part of the rules set of the countries running or the world's running. But we can create parallel organizations like pressure group organizations that can also look at the same thing, just like FLCCC looks at it, or other such organization. They would look at Bird Group in UK. They'll look at something and they'll say, this is the right thing to do here. And now people would have a contrasting point and say, well, WHO is saying this, and this group is saying this, and this group has been always right or mostly right. So I'm going to listen to them. And then folks on WHOs and CDCs and FDAs would have to have some thinking to say, we need to align correctly, otherwise we'll just keep becoming irrelevant. So I think that is how these things would change, and they would change. I don't think that they would stay the same. James Nguyen says, Dr. Bean, the problem is when they create non-profit as well to destroy even more people. That is true. So this is I think in my country, the country before US, once my uncle told me, he said, do you know why our politicians fail? I was young, and he said, our politicians or political parties continue to fail because as soon as a party starts doing good, the other less honest parties introduce elements in there that would go and start corrupting this as well. Or they would be just people who are greedy, and they would start aligning with this party, which is now on the rise because of their honesty and service. And now they would start taking advantage of the situation. So I think this is going to be always a case, that there will be a push and pull to continue to calibrate and refine the system. But this current system, where it has reached, if we pray that there will be no more pandemic, it's going to go back to the normalcy before, and we would start humming along just like it was before. But we would not find solutions for cancers that easily, because the system is not capable of bringing us there. They're actually taking advantage of those things. So we'll have to have some change. I don't know what exactly would happen, but there's going to be change. This collective mind that has become so acutely, painfully aware of the issues, there's going to be solutions now. Nate says, why are the blood works normal if you're having an inflammatory response? So if there is inflammatory response, there will be blood work that shows inflammatory response. Now, let's say in this kind of a case, and I'm going to assume, let's say in this kind of a case, there is no systemic huge blood work difference that you're seeing, but the monocytes are still dysregulated, and they're sitting next to the blood vessels. And if they are going to be causing local irritation and inflammation, that may not appear in the bloods, in the blood work, because the amount of cytokines released is tiny, but at least that is causing local congestion, which would appear in symptoms. especially for the head and neck area, because brain is closed in this bony wallet and it cannot afford any pressure changes out of the normal ranges. So maybe that is the reason. James says will come out even stronger. Absolutely. Yes, so this is also important. Aspirin is an important thing. JLB says, I have seen a lot of people 1 month after the first Astra dose stay overnight with a little cough. Can it be considered long haul? Any protocol suggestions? So could be. So don't know exactly what happened, but let's say if we assumed it was that, then once again, I would start from here. Ivermectin is the first one. Add fluvoxamine, add steroids. That between these three, usually patient starts feeling better. But if they do not, then I would switch to some of the mast cell activation management. Casey says, hi, Dr. Bean. I came across your wonderful channel only 2 days back, and I'm trying to study your informational videos one by one. Thank you. Greetings from Singapore. You are very welcome. Welcome to Cool Beans, and greetings from the US. And actually, all of us Cool Beans are from all over the world. So welcome. Lonnie says, please explain what Dr. Patterson said about predicting long haulers with monocyte measurement. What are the markers? So I have to actually draw that mechanism to understand more. So I know that he talked about the prediction. I want to yet understand it. So I'll discuss it. Piano Blog says, is there truth to the idea that pain relievers should be avoided at the time of vaccination? It strikes me that aspirin could mitigate some risk, but maybe it dampens effectiveness. No, it will not dampen effectiveness. Aspirin, there's a video I've done about aspirin, and that is that it blocks the cyclooxygenase enzymes, which cause inflammation. And we know that giving aspirin does not just abolish inflammation, it just reduces pain for some time, and then the pain bounces back. So it is not something that would just stop the immune system in its tracks. It just reduces some inflammatory cytokines, especially those prostaglandin and leukotrienes, which are related to pain and local swelling. And that's fine. It would not do anything. Roman says, can we put in a request for an interview with Dr. Varone? He's an active doctor in FLCCC, and his hospital is the only one in the nation treating with, oh, wow, Luffy Mectin. Okay, I'm going to ask, let me ask Melissa right now to reach out to Dr. Varone. So 1 second, please. Okay, so done. We will request him to join us. Augie says, when does the repolarization treatment start with ivermectin or prednisolone? So both of them, I think, would help. Ivermectin would help with the spike protein and some anti-inflammatory, so that would help repolarize. And then steroids would definitely help with the repolarization by suppressing the whole immune system and letting the system calm down, and then take a note and hopefully clear out these cells. Texas says 44 out of 144. Get point. That like button. Yes. Bambi Secret says, I feel like singing. Let's go to San Francisco where the flowers grow so very high. Sunshine in San Francisco makes your mind grow up to the sky. I love San Francisco. So I'll tell you a funny story. I used to be on the East Coast in Massachusetts. And one year, my company sent me for a conference here in San Francisco. And it was so much fun. I came in for about a week for a conference. I went back and I said to my manager, I said, if I went to San Francisco one more time, I'm going to resign and not come back. And they laughed it off. So, sure enough, about a few years later, I was sent to another conference and I went back and I said, I'm done. I am resigning. And then it so happened that I finally moved here. So the long hauler course is normally 12 to 15 months. So, Anika, we don't know when does it stop. Does it stop after 15? We just have lived with this disease that long. It may continue on for longer or it may be shorter. But we know that there are some people who have suffered this long. Denise says that my pain management doctor is the one who figured out how I have mast cell activation syndrome. Got it. So I am very much sure that tomorrow I'm going to go to San Francisco. I did not go last week. Remember, I think I went to my colleague, and then last week I missed it as well. So hopefully tomorrow I'll go. So ET says, I'm curious what he meant last night by reservoir and making sure that the virus didn't have one to prevent long COVID, meaning some extra monocytes that are sitting around and virus just happens to start using them. I have to look at the whole mechanism. So I'm not fully up with it, but at least we have his message. Bilal says, Dr. Mubin, so are we going to see long-term syndrome with long COVID vax, COVID like autoimmune disease, maybe like MECFS? So far, the signs are that no, we will not. In some people, it is poking or triggering the MCAS or unmasking the MCAS. And if that is the case, they may have MCAS continuing for longer time. But most of the patients who I'm seeing, they usually start improving maybe very gradually. And if you give the medicine, that accelerates, the improvement accelerates. Some folks go hills and valleys. If it is related to monocytes only, let's assume there is no other pathology, just this much, then this pathology would be taken care of by getting the monocytes cleared out by these medicines. But if there is an underlying MCAS mechanism or mast cell activation, macrophage activation, or some other pathology, which we, let's say, are not aware of at this time, then we may have to still struggle some more to figure it out. From a clinical observation point of view, so far all patients continue to become better instead of worse. And Nicholas says, it don't go. Oh, wait, I have it for 11 months, the side effects on COVID. Try this long haul protocol. Oh, wow. So, yes, the streets are great. Michael says, I lived in San Francisco for 20 years. It's a beautiful place. You know, when I go to San Francisco, I turn off my GPS and I just let ourselves be lost wherever. And then it's just a beautiful place. Artless Calamity says, Bay Area is great, but no one can afford to live there anymore. It is great. It is expensive. I understand that. So I am in Cupertino, which is what is fun for me is that the Apple building is about 10 minutes from here on a drive. And the local Starbucks where I go, I have seen Tim Cook, Apple CEO, a couple of times getting coffee from there. I don't think that he needs to come there for coffee, but I think maybe he has walk as a goal. James says, well, that's smart, Mr. Bean, but I have I hate driving there. So we go over the weekend. Mostly over the weekend, the traffic is not that heavy. So Luis Grande says fractal kenes observed adhering to vessel or chemically measured and hypothesized. So fractal kenes generally so of course this is a receptor and a ligand. So there is a receptor and there is a ligand and they bind together. So ligand is on the endothelial cell already and the receptor is on the non-classical monocytes already. So they just bind. Chiao Liu says, Dr. Bean, I compared the death rate from US COVID case statistics. At the peak of pandemic, that death rate was 1.3%. Now it is 2.6%. Does this mean we have more unreported cases recently? Possible. Can you tweet that to me so I want to see it? Interesting. Augie says, are exosomes a fake treatment? So I don't know. There are some treatments which really don't make sense. Artless Calamity says, what's your leading hypothesis on what is causing neurological symptoms in so many long COVID patients, brain fog, memory issues? Are we looking at permanent problems? No. So I was actually explaining it, and I may be wrong. What I'm going to explain here, I may be wrong, but let me at least explain how I am looking at it, thinking about it. So, so let's say this is the brain. So this is the brain tissue. We know that in the temporal lobe area, this area, we have memory forming systems. We also know that within the two hemispheres of the brain, we have the exchange of the recognition of, let's say, visual clues and giving them name and memory and recall and those things. If there is local inflammation, let's say at the boundaries of the blood vessels, which causes some more pressure in this system, not enough to cause hydrocephalus-like things, which is inside the ventricular system, but just enough pressure that there is extra congestion in the system. If that is happening, then we could have these kind of issues where the tissue itself isn't performing well. And that lack of performance or low performance would, for example, the memory system would not work correctly. And so making new memory might be a problem. Recall may be a problem. The confusion or the disorientation is actually because of the recall, that we cannot recall where we are, what is our name, what is this surrounding. Then patients who say that, hey, my eyesight is weird. So this is the kind of thing they use. They say, well, my let's say this is they say that, hey, I have a problem with my eyesight. The problem is not really with the eyesight itself. The problem is processing of the image data. So normally what happens is that when we have the image data available, we ignore a bunch of it. So right now I'm speaking with you and I have things all around me and the lights, and I'm ignoring all of that. And I have a very specific screens and the drawing pad here, which I'm focused on. But when the congestion has occurred and the brain neurons are not firing correctly, then what happens is that we have started processing everything. And all of a sudden, for a patient, it seems like I'm overwhelmed by all this information because brain is not cutting out the information that it should be. That means it's not performing optimally. This is the question I asked to further part of your question yesterday from Dr. Patterson, that is there a chance that there would be damage if it continues for a long time. And I think he didn't respond, uh, in my opinion, and he was right in not responding, because that would have been a hypothesis or a thing to tell about future, and people could just call him out and say, how do you know? So I think that if a blood vessel is continuously attacked, so let's say here's a blood vessel, and this is continuously inflamed, eventually the foam cells will form, eventually atherosclerosis would occur, blood vessel wall would become more stiff, the lumen would become narrow, and that would cause more difficulty with brain's function. Brain needs oxygen. Somebody said to me that, hey, I used hyperbaric oxygen chamber, and he said the brain fog disappeared like magic. And that tells me that it is something to do with the oxygenation and the tissues better nutrition or status. So I think if I go back to this, we should quickly solve the problem so that we don't reach a point where blood vessels are getting damaged. But if we quickly do it, I don't think there'll be a permanent issue. So Adina says, so grateful for our fearless leader and Cool Beans community. This is a supportive, intelligent, medically savvy community that I've learned so much from. You enrich my life during this difficult time. Thank you very much. We all did it together. And that is, in this last 12, 13 months, we were watched 250 million minutes, 250 million minutes. That's a lot of minutes, because I did not set out to do that. So we all came together, we helped each other, we discussed with each other, we became friends, we supported each other, and we found solutions, we found hope. And I think that is how we just kept going. I think we are a very good tribe. So thank you very much. Blank says, blank, I saw you after a long time. Sorry if this was already asked. Are the people severely affected by COVID-19 the same people severely affected by the vaccine for basically the same reason? That's a very good question, and we don't have that answer yet. I think about it very often, that somebody who responded badly to a vaccine, would they have responded badly to the actual infection as well? Don't have the answer yet. But I can tell you this, many people who had the infection, for example, I have a patient who is a long hauler. She is 25 years. She had the infection asymptomatically. I do not know who told her to go get a vaccine. She had the infection asymptomatically and decided to go take a vaccine. And the second shot, a month or month and a half after the second shot, now she is a long hauler with the vaccine. So now if you look at the first situation, the COVID was not high intensity for her, but the vaccine became. So don't know that relationship yet. SP Chandra says, it is said that the vaccine can cause infertility, but the vaccine itself has only been around for a year. So on what basis this is said? I don't think that it causes infertility. We talked about it before as well. It can cause irregular periods. That is not related to the ovarian damage or the uterine damage. It is related to the inflammatory system, antibodies production, cytokines production, causing dysregulation, and it goes away within a few months. Anika says, do you think that aerosol viral fragments can aggravate the long hauler just like the vaccine? This may explain the ups and downs people experience. That's a very good theory. I do not know. So what you're saying is, imagine if I had the infection, then I became long hauler, And now every time I'm exposed to the virus, sitting next to someone who is infected, I got the virus and my immune system responded, and then I have a hill, and then as I'm away, I go in a valley. That's an interesting thought. I do not know. That's an interesting thought. Is Nipa here? I saw Nipa Gandhi's name. Or did somebody just write her name? Roman says, we as a Cool Bean community are 100 times better than those government medical agencies. That's true. Actually, I was comparing in my own mind our community to even communities of other internet doctors. And I saw that many of them are just, here is news. And some are more medical oriented too. But the depth with which we discuss and understand things, I do not think any other community has that depth. So the DJ of choice, good name. Do you think that spike protein is cytotoxic? So spike protein causes inflammation. That is cytotoxic, one. Secondly, spike protein, when bound to AS2 by itself, I did that studies discussion, by itself can cause disruption of the cellular signals, causing the cell to become a victim of inflammation or die. So that way it can be cytotoxic. When folks ask me that in some other context, and there's a different answer, but generally from the studies, if just this is the question, is it cytotoxic? If it is poured on a cell, it can be cytotoxic by both immune system response and by activating the AS2. James Newn says, Dr. Bean, did you know San Francisco is requiring all the city workers to get the vax? No, I did not know. And I don't like these folks doing this. Jody says, Dr. Bean, do we really need HIV meds when ivermectin and antihistamines work? So if ivermectin and antihistamines are working, no need to go for Maraviroc. So I don't give Maraviroc to my patients. Barbara says, yes, Dr. Bean, Medical Access, we are a very good tribe. I am eternally thankful for these connections. Thank you very much. Me too. Yesterday, I saw an interesting dialogue happen under the video. Remember when Dr. Patterson was talking and Luffy started chiming in? So somebody became a little upset and they said that, why don't you open the door for that cat and let it out, or go feed it so it doesn't talk? And somebody else responded and said, it's Luffy and we like Luffy, and Luffy chimes in very often. And I was just sitting and thinking that we have become a very cute community. FLCCC doctors know that there is Luffy, and when they're gonna join, Luffy's gonna chime in. And so there are doctors who are world-class doctors, and they are okay with Luffy there as well, because that is just part of who we are. Yes. Somebody had put a cute comment saying, I like you because of some things, and then they said, and you are ruled by a cat. So that is true. The cat has been ruling us for some time now. I think we should become rebellious for some time. Intrinsic one says, can hydrogen water contribute in transporting oxygen to the brain? Tweet at me the mechanism. Jody says, honestly, sounds extreme. Possible. Jody, I am with you. But maybe if somebody is not recovering with other means, it may be necessary. CJ says, Dr. Patterson did not fully answer the question regarding whether or not new monocytes were also expressing S1. Also, is the monocyte issue only seen when COVID or also post-vax? Good question. I asked him that question, and I know he didn't respond, and I understood why he did not respond. If you ask me that, hey, will new monocytes have it? The only way I can think of them having it is that their parent cells, or the stem cells, or the monoblasts that are living in the bone marrow, somehow they have the infection and somehow they are propagating the infection or S1. Another possibility is, as I discussed today, that one monocyte that has S1, when it dies, it is eaten up by the other monocyte, and now the S1 just transfers to the next one. Normally, everything is digested and killed and removed, but maybe S1 just keeps moving forward. So I don't think he had an answer. And which doesn't, it's not an offense to him. It's just that it needs more research, I think. It's people like me who sit here and say, okay, I think it is this way. He was representing a company and more scientific grounds. Jellybean says, but the vaccine protein is locked in pre-fusion state. How can it be toxic? So S1 part still binds. The post-fusion state, so the vaccine is not locked in pre-fusion to make it not cytotoxic. Vaccine is locked in pre-fusion so that our immune system learns to go against it in a state where it would appear on the virus. So this is the vaccine, let's say, vaccine generated spike protein. And let's say this is the S2 part. This is S2. And then this is S1 with the receptor binding domain, and this is the receptor binding motif. So you're correct that the vaccine is kind of stuck in this state. It cannot open up. It cannot become, let's say, this way, and the S1 cannot separate out, or this thing does not happen with the ACE2, and then S1 fuses. And the reason, once again, it's not because they didn't want it to look like this, or it would have been cytotoxic or something. If it was opened in this state automatically, then there may be antibody that goes and bind here. Now, when the actual vaccine comes in and makes the spike protein, or when the actual virus comes in and that has a spike protein that looks like this, and we have trained now our immune system to attach here, that part is not going to be showing up for the virus because the spike protein is still in a closed state. This is why they locked it. But can it still bind? Yes. Now, if it binds, can it cause the signal disruptions that it does? Yes. Would it go to endothelium and cause it? That is something that still needs to be debated. It can cause this to the local cells if it binds anywhere, if it spills out. Our patron says, Dr. Bean on side of road holding sign says, will work for cat. Yes. If it is totally in Luffy's control, he would send us out to go earn some more things for his kingdom. Srinivas says, can you categorize COVID-19 patients depending upon the severity and suggest a current treatment as per your best of the knowledge? I was actually thinking that we should do this management. So Srinivas, please tweet at me. It's not to get more Twitter fans and followers. Tweet at me. What happens is I can take those tweets and give them to my team to say, prioritize this topic. So please send it to me, and I will then prioritize as a separate topic. I don't want to mix it in here. People would not even know that this is something that was talked. Denise says, Dr. Bean, I've been suffering from vax, dose 1, only of Pfizer, since March. It finally seems to be getting a bit better. I've sent for the Peterson panel. My platelets are currently borderline large. Do you know why? Thank you for doing what you do. You explain things so well and are so kind, and Luffy is cute too. Thank you very much. Now that you call Luffy is cute, I have to answer your question. So, because if I don't, then Luffy is going to come and kill me. So platelets large, the question I would ask is, how are the other cells? Are they large as well? For example, RBCs, are they large too? If the other cells are large as well, that simply means that the production of the cell is slowed down. That means patient may have vitamin B12 deficiency, folic acid deficiency, and their cell production is taking more time. And in that process, brain is still developing while the remaining body becomes big. So that is one possibility for cells, but then all cells would become larger. If it is only the platelet that is large and the other cells are of normal size, then that may be because platelets are a little more active and they are making more plasma granules and their proteins that they contain in them. And that is what is making them a little bigger. But again, without knowing all the labs, I can't say. Uh, LL Hannah says, thank you very much, Super Chat. Thanks to the Luffy Kingdom. Yes, this is a Luffy Kingdom. The whole day long, we are serving Luffy. Sometimes he wants to go out. He has learned to stand at various doors and meow, and which means I want to go out now. I want to go here now. I want to have this seat now. I had actually, so there was a day that he stopped sitting on this chair. So I removed it. It looks odd for this chair here with a blanket on it. So the next day he came in and he just would not go from here and keep doing this meow and standing up. So I put the chair back, I put the blanket again, and he now starts sleeping again. So we are at his service. Bilal, New Jersey. Dr. Bruce mentioned yesterday about wax long haulers are treatable and something not concerning. Is that mean treating post-wax haulers easier than COVID long haulers? I think they both should be similar. And this is Anika, this is possible. Anika is saying that maybe that Dr. Peterson team were unable to design a marker to bind to S2. That is exactly possible. I had that in my mind. And that is why they're not finding it possible. Petisik says Luffy has Dr. Bean trained. He's totally trained us for his needs. JLB says, next life I want to come as a cat, Dr. Bean cat, mostly, absolutely. And you will be serviced and served, and we will be at your service. And yes, correct, Michelle. He has learned to open the doors. He has torn the doors apart. So he has learned to push his nail in the doors paint and the wood and pull it, and he has scratched them all and he can pull them. Same thing he did with the curtains. All of our curtains at the lower ends are all pulled and kneaded. So the whole house is actually Luffy's house. We live in it. Glenn D. Swank says, does COVID-19 cause a depletion of fractalkine in the brain, that thus causing increasing brain inflammation? No, actually, it does not cause depletion of it. It causes fractalkines to be expressed and receptors to be expressed and do more binding with the non-classical monocytes, causing inflammation, which then causes the blood vessels to kind of leak, or as we should say in medicine, cause local congestion. Embol says, when someone sheds the virus, what percentage of them are not viable? That's a very good question. So first, I want to apologize to you, Embol. You said that I did not take your question. I don't even remember seeing it, so it's my fault. I would call Bruce on Monday or Tuesday and ask your question and get you the answer. When someone sheds the virus, what percentage of them are not viable? That is a very good question. I do not know the answer. That's a good question. Interesting question. No, don't know the answer. I'll have to look up. Jan Masleet says, I purchased his Ivermectin Man, which was printed onto a gorgeous stainless steel thermos teespring. Thank you very much. And Jan, you are Luffy Mectin on Twitter, right? So Luffy is a smart cat. Yes, at least smart enough to train his humans. Uh, all things lymph says, is the spike protein sticking in our lymph system in the dura mater of the meninges of our brain? I don't think so, but there is no study saying yes or no. This particular case is different. This case is where the blood vessels have monocytes causing irritation. Passing time says they don't have Luffy. Yes, no one else has Luffy. Luffy is actually a young cat. I think he's in 7th year now. So he is in that teenage time where he's the naughtiest cat around. P. Lee J. says Dr. Jalali's findings about serotonin was exciting at the time. Do his findings, lung endothelial, and Dr. Patterson smashed together somehow to give a clearer understanding of COVID? So, to my surprise as well, I have actually tried some of the cases with cyproheptadine. I did not see a good response, but the antihistamines have worked. I was actually thinking of calling him once more to say, can we sit down and talk once more and maybe have a protocol that we try? So it is possible to smash these two theories together. I need to kind of use his medication in addition to the existing medicines to see how would they work. I'm not seeing much. Bob says he needs a scratching post. He has the scratching post. He has everything. He has a scratching post out here. There is a scratching post actually hanging with this door. There is one sitting in the middle of the staircase. He has everything. He is just spoiled. So Denise says, are you concerned about Delta Plus? So I was actually reading about Delta Plus today. Not concerned yet, but that is because I'm yet ignorant about it. So I'm going to, over the weekend, read a little bit more. They said 200 cases of Delta Plus. The question is how fast and what are the changes in it. So Denise, I'll look it up. JLB says, probably doesn't like your curtains. Correct. And when he sits and needs us, does he not like us too? So it is so funny. He scratches. He sits on my wife's lap the most, and so he just scratches and is brutal. I don't let him scratch me to the point of injuring me. So I usually quickly go and get a blanket and put that on me, and then he sits there. Artless Calamity says, I know Dr. Patterson released machine learning research and FLCCC released their LC protocol, but doctors I speak to are still waiting for clinical data. Will we see that soon? So clinical data would continue to come together. I do not know if there are studies going on, but I just feel bad about the doctors who are just waiting for the clinical data. What are they doing in the meantime? They have a patient who has long haul symptoms. Do you know what majority of the patient tell me? That the doctor simply said it's in your head. I don't think there can be more damage done to a patient by telling them that you're insane. So many of these things, ivermectin is small therapy of steroid, small therapy of fluvoxamine, small therapy of statins or vitamin C or melatonin. They don't hurt. Or antihistamines. They don't hurt. They can be tried. Petizik says we'll wait to see Kyrie as well. I was making Kyrie's video a day ago. She was the funniest. So Kyrie does not take this much of liberty with us as Luffy does. So Kyrie was, I'm trying to see if I can find her video. She was just sitting next to me on the carpet and she was just kneading away at the carpet and pulling things out. So I had made her video. I can't see it. So I'll show you the video next time. Cool. So Zain Solo says, are messenger RNA vaccines really safe for children? The 50% of cardiac inflammation occurred in 9% of the population, that was children. So to me, that is a very high percentage of damage. And CDC came back and said, all good, keep going. Or the risk is lesser than, the benefit is better than the risk. So this is one case where I really am angry on CDC for being so stupid to do this, to come back and simply say, you know what, risk benefit analysis we did fine, when they are saying that 9% of the population is children and 53% of the cardiac inflammatory cases are in them. So in my opinion, there is a risk there, and because of that, it should be there should be a very careful decision. Cool. So let's do this. Let's stop for today. M. Gregory has a question. I'm not vaxxed. I'm putting my family members that I live with in danger. They are vaccinated. No, you're not putting them in danger. They are vaccinated. Look, yes, we know that vaccinated people can still become sick. Some of them can die as well. But for a majority of the cases, vaccinated people are much more protected. So I don't think that there is a risk, but we can't rule out, because vaccinated folks do get hospitalized and some die as well. Schuster says, do you think the EU and USA will authorize ivermectin as a prophylactic anytime soon? I don't think so. I think at least in the US, doctors would continue to increase who would use ivermectin. People would continue to know more about ivermectin, but I don't think that the authorities would do this. They're just not going to do it. I don't think so. Cool. So the DJ of choice says, thank you, Dr. Wing, from one cat lover to another. Thank you very much. Luis Grande says, how is Mrs. Bean symptoms responding to treatment? So she does not need any further treatment. Her symptoms have become almost gone, meaning she does not complain about them anymore. I saw her a couple of times that she slept at time where she normally does not, which told me that she still feels tired, but generally she is active in her normal day-to-day routine, and I don't see those symptoms anymore. So that is a good news. Thank you for asking. Clean Nose says, hi, Dr. Min, is it riskier for a stroke survivor to undergo vaccination with Pfizer? Will the candesartan or clopidogrel or doxycycline, vitamin D3, and atorvastatin pose any contraindication or compromise? So the most important thing is for the drug-drug interaction, just go to drugs.com and look at the interaction there. But for a stroke survivor, vaccination, Pfizer, messenger RNA. So generally, it is not contraindicated for stroke survivor. Neither it is contraindicated with these drugs. So that should be okay. It's the ivermectin that we should look to be careful with the blood thinners. Cool. So thank you very much for today. And James Crooks, thank you very much for the super chat. Thank you for today. Have a nice, there's a question from JLB. They can't authorize ivermectin besides other. If there is a known medicine authorized, they cannot give emergency use to other. Correct. So if there is a known treatment, then the authorizations cannot be given. So you're correct. Liza is here. Liza says, people who become long hauler after jab will become long hauler after every booster shot? That is a good question. So I saw that some of my patients didn't have anything after the first one, but after the second one, they had it. And in some patients, they became COVID long haulers and vaccine helped them. So it's meaning there is no real data there to say if this, then this. So thank you very much, everyone. Have a nice weekend. I'm going to go to San Francisco tomorrow, hopefully. And please like, subscribe, and share. And there are 3 links in the description if you wanted to support this work. One is to buy me a coffee. Other one is to use PayPal to support this work. And third one is to be a patron. Thank you very much. And I would see you on Monday. Bye-bye.